Good morning, everyone. I'm a few minutes late. It's 40. It was a little bit delayed with my need to stop for Starbucks. I have to have my coffee. Anyway, this is Dr. Mitra Ayozifar. I'm your ophthalmologist in Northern California with two locations, one in Roseville, one in Grass Valley. And my team and I help patients develop their best vision possible and live life fully and enjoy their hobbies for years to come. I'm so glad to be talking to you today. This Monday morning is my usual Facebook Live, Monday at 8 a.m. or 8:03 in case I'm a little late. So today the topic that I was going to talk about is it possible for your eyelashes to be rubbing on the eyeball? There's a lot of patients that, and the quick answer to that is yes, of course it is. So there are different reasons, of course. One can be that the support for the lower lid, because as we get older, there's laxity in the lower lid, and so the eyelid either turns in or turns out sometimes. And if it turns in, sometimes patients will come in and especially when they squeeze or even when they sometimes blink or anything, the eyelid can gently turn in, and of course the lashes will start turning in and stay there. So every time they blink, these lashes are going up and down like a windshield wiper, but doesn't feel good. And if it's not treated, that's called entropion. And if it's not treated, it can lead to um, basically scarring on the cornea. And that's definitely something that we try to avoid. So the feelings that they will have or the symptoms that they will have is foreign body sensation, pain with blinking, feels better if they're closed their eyes. And of course, at nighttime, seems to be much better because they're not blinking all the time. But once they're awake during the day, it definitely does not feel good. So that's one reason, the support of the eyelid. The other one is that sometimes patients come in and there are localized areas where the lashes, instead of the hair follicles, instead of growing out towards the outside away from the eyeball, it's turning in. And when I look at the eyelid margin, there may be like a dip or a divot, almost like a scar on the eyelid margin. Usually what that tells me is that there's a history of some sort of either procedure, or they've had issues with like a sty that has been surgically treated or basically resolved on its own. And what happens is they develop a scar within the eyelid, um, within the eyelid margin, and it essentially turns the angle of the hair follicle. So instead of it pointing out, the hair follicle is directed such that these lashes turn towards the eye. And so again, just imagine, just this going up and down every time you blink. There's like a feeling like there's something in your eye. And what happens is these patients will have tearing because the eye is irritated, and so there's a signal to your brain that, hey, there's something in the eye and we need to clear it up. Or just blurred vision. It just doesn't feel good to be able to function normally. So working on the computer, reading, all of that is going to be difficult. So that's called trichiasis usually, or it grows out of the wrong area of the eyelid margin. That there may or may not be scar tissue related to that. So all of these are situations where we really need to deal with misdirected lashes or kind of eyelashes growing out of the wrong portion of the eyelid margin. So what do we do about that? Some people, they go to their eye doctor, eye surgeon, and they have these lashes plucked. Okay, just like we pluck our eyebrows, they pluck the lashes as soon as it starts bothering them. And usually that's a commitment, like every 6 to 8 weeks, because that's what the growth cycle is going to be like. So even if we pluck these lashes, we're not necessarily destroying them completely, they're going to come back. So that is something that's not going to decrease the growth. So you're committing to that. It's not very comfortable. I have some patients that sometimes have been planning their, events around, oh my God, I have to go to the eye doctor, get this done, and then I'll be fine for this vacation. So that's not the best plan. But the other option that at least decreases the number of lashes and also decreases the thickness of those lashes is doing electrolysis. Yes, you heard me. So the same procedure that was being used before lasers, and maybe even now for some people, is it was being used for going into each individual hair follicle and zapping it with a tiny little dose of electricity. And essentially, the eyelid needs to be numb. So if patients come in and they have a patch in the center, let's say they've had, skin cancer removal, or they've had a sty, and now these lashes grow towards the eye, it's an in-office procedure. So I numb up the eye with lidocaine. That part stings. That's the part that I tell patients, once you get through that, you're basically set. And then I make sure that they're numb, obviously. They sit behind the slit lamp because obviously it's very difficult to see these lashes. And then the electrode, the little tip for electrolysis is very, 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 very thin. I think it's thinner than the usual needle. And so that goes directly into the hair follicle shaft and goes along the shaft, goes to the hair follicle. And essentially, with a foot pedal, I have to direct a tiny bit of electricity to the hair follicle. And I just gently tug on that eyelash. If it slides out without any pressure, we're there. If it does not slide out easily, then I have to repeat that treatment on that hair follicle. So I usually tell patients, come back within 4 weeks, 4 to 6 weeks. And we'll have to repeat this treatment. And basically what's happening is we're catching the other hair follicles that are on a different growth cycles. We're catching them. And this, treatment may have to be repeated sometimes 6 to 8 times. And each time, as we catch these hair follicles, they come out much thinner. And at some point they stop growing. Kind of freeze the follicles, but then that kind of causes some scar tissue. I have never done it. I would recommend it in the hands of someone that has done it before, but I would probably do that only in situations where this is not working for you, because we want to preserve the so we want to make sure that we preserve the cosmetic appearance of the lid, and yet treat the problem. So that's my spiel on trichiasis and entropion. If you notice that this is happening sometimes with the eyelid turning in, it doesn't happen all the time. It happens sometimes. And yet, it's spastic entropion where it happens sometimes. Sometimes the lid just flexes in. But you want to catch it at that point before it starts really becoming a full-time issue that's bothering you. So that is it. If you have questions, come on to my website. Come and give us a call and see me in the office, or even with a telehealth video visit. I can help you with that. My practice is Capital I Medical Group. My website is www.mitramd.com, mitramd.com. Come on down. I hope you were able to catch this whole thing. I'm not sure when my connection was a little bit affected, but I will see you next Monday at 8 a.m. I will figure out what other questions you have for me to answer. Thanks for joining me or watching this on replay. See you next week.